Ever wake up in the morning, ready to start your day, head to the bathroom, look in the mirror, and see a huge pimple on your face? For me, I know it's there before I even look. But the hardest part is resisting the urge to pop it. I've used things like ice cubes to reduce the swelling, super hot water just to get it gone. I want it off my face. But is this really the best route to go? Should we fight the urge? Let's see what an expert has to say about it.
How to pop a pimple. Please don't pop your pimples. You can cause a lot of damage when you pop your pimples. Let's talk about the different types of acne spots that we see and what you can do about them. So we see blackheads and whiteheads, very small little whiteheads. You see papules and pustules, which are bigger lesions. And then you see deeper lesions that are called nodules or those undergrounders. So why do dermatologists hate popping pimples so much? The first thing is that acne is inflammation. It's redness and is swelling. And then you're going to take your hands and push and prod on the pimple, which is going to make it more red and more swollen. Secondly, your hands may not be so clean and you may just disrupt the natural bacteria that are on your skin, and you could develop an infection, which would make the whole situation much worse. And then the final thing is that manipulating the skin, popping pimples, can lead to long-term scarring that will last a lifetime. So what's an alternative to popping a pimple? I would advise using a medicated lotion with benzoyl peroxide or salicylic acid. These products will dry out the pimple, but it will also get at some of the root issues behind the acne and clear it up at a deeper level. If you want to use ice or heat on your pimples, that's fine. The ice will actually slow down the process and decrease inflammation, and the heat may speed it along a little bit quicker, but I would skip the pimple popping portion of that tip. So what should you do with the very deep lesions? These are the ones that I feel it's very important not to pop. There's not an infection there that you're trying to release. You're not actually going to get anything out. You're just going to make the situation worse. It will be more red, more swollen, and it will last a much longer time. While spot treatment is great for a quick fix, what you really need to do is have a regular routine. If you're just treating individual spots, then you never really get ahead of the acne. So using a daily routine will help to decrease the amount of breakouts that you have and to keep your acne under control.
So the best way to pop a pimple is to not pop your pimples. The secret, and now not really secret, is in your daily skincare routine. I like to start with my gel cleanser that has a physiological pH that won't worsen my skin's condition, and it also helps to remove impurities that occur and thrive in oily skin. Followed up with an astringent lotion. This is going to help to exfoliate, unclog your pores, and then finally something like a global acne treatment to help not only the acne that's on your face, but to help with the reoccurrence of keeping it away. So next time you wake up with a pimple, stay strong, my friends. It should go away with your daily skincare routine. And for more severe breakouts, be sure to schedule an appointment with your doctor.